Welcome to this short video in the 5 Minutes of Supervision series. My name's Matthew Links and I'm the Discipline Lead in Medicine at Bond University, and I'm speaking to you from the land of the Kombumerri people on the Gold Coast. Today I want to talk about assessing a mini-CEX. These supervision tasks can cause some confusion, so today I'm going to share a simple guide on how to do it. If done badly, mini-CEX are a tick box exercise. If done well, they can be the best learning a student gets. Good supervision is a relational process. It's learner-centered and evidence-based. In order for students to learn, they need feedback on their practice. And in order to assess someone, they need to feed forward information on observed practice to their clinical supervisor. A mini-CEX is essentially observed practice. We like the process to be self-directed, but self-direction requires a lot of guidance. It's therefore helpful for you to be able to plan feedback opportunities with a student. Planning gives you a chance to direct student tasks that are meaningful for them and helpful for you. And that depends upon the clinical opportunities this placement provides and your input. Think about what times feedback opportunities occur. However much we plan, often feedback opportunities are opportunistic. Sometimes there's a time opportunity, a cancelled patient in the clinic, or a bit more time when patient's been discharged before next intake. Or perhaps there's a clinical opportunity, a patient with myasthenia gravis that needs serial neurological examination. Or perhaps your registrar needs feedback on their teaching and they can do the mini-CEX feedback and you can give them feedback on their teaching. All of these are potential opportunities. Now, feedback's basically reflection on students' performance, and we teach students this self-reflection model, and it's useful for your reflection on their practice as well. What, so what, and what next? The bit that's most often missing from feedback is the what's next. It's also worth thinking about what aspect of a task we give feedback on and what perspective is taken. For example, if a student does a new admission and presents a management plan at handover, we make a choice about what aspect of the performance we give feedback on. The 4 domains of the curriculum give an opportunity to comment on maybe the interpretation of the ABG, the drug therapy, the barriers to care, or teamwork. Thinking about the patient broadly across the curriculum represents broad reflection. You can't comment on everything, so the choices we make are important. Deep reflection means getting beyond the task. There are different levels of feedback about the task, from basic comments, like leaving out stuff, to the process about how the way the task was organised. For example, what structure do you use when you think about differential diagnosis? To feedback that explores emotions or beliefs about self. How are you feeling about your diagnostic skills? What do you think are your strengths and weaknesses in diagnosis? Deeper levels are particularly important when trying to understand why a smart student is not performing. Students' suggestion for what's next often focus on reading more and studying more. Giving students more specific suggestions help. The 4P model of learning and practice helps in this regard. How can they prepare? What should they practice? How will they get more feedback? And finally, how will they document what they have improved? So having given some really good feedback, don't leave it there, follow up. Follow-up is a key component of a shared understanding of what's next. This allows you to evaluate whether the feedback was effective. And if it wasn't, you can identify what the barriers are and try again. The learners who have the most trouble are those that can't listen to feedback and improve. This is a key observation from repeated feedback on the same task. If the performance wasn't satisfactory, offering to repeat the process is really helpful after they've tried something different. And if it was great, suggesting a different activity would be helpful. So having major assessment, documenting it's critical. Learners need to prove they're competent, and real-time feedback is the most helpful way to improve the quality of the feedback that you give. Now, assessing performance should be easy, so it's better to make it brief, focused on 1 or 2 things to improve, and be frequent, rather than exhaustive feedback about a single task that never gets done again. Students should be expert in the system. They have for documenting feedback at their university or training provider. So tell them to make it easier for you to give them real-time feedback, and if there are problems, they should be able to be the ones who problem solve them. So mini-CEX are a key way of observing practice and providing documented feedback. There's a balance between planning them and doing them on the fly. A basic reflection model can help you structure your feedback. What you give feedback on is a choice, and you can choose to give feedback broadly across the curriculum, including professionalism and social determinants of health, and deeply probing underlying thought processes and organisation of the task and the emotional content of the task. Making good suggestions about what's next links the feedback to future learning. Follow-up is invaluable. And finally, documentation is critical, but keep it simple and focused on improvement of one or two things. I hope you found that useful. If you're interested, check out our other videos in this series or these references for further reading. Good luck, and may your mini-CEXs be real opportunities for the students that you're teaching. Good luck.